Hi, on here we talk tips, tricks and strategies that you need to implement right away in order to fall pregnant fast. Hi, I'm Dr. Kady. I'm a board certified family doctor. Here on this channel we talk health, but more specifically we hone in on women's health and fertility medicine. The first tip in this episode is reduce stress. Let me explain what happens when your body is stressed. When you are stressed, your body will shut down non-life sustaining processes that happen within it in order to maintain the function of crucial life sustaining systems such as the brain, the heart, and the kidney. So if you've been stressed, particularly if that's been the case for a long period of time, you've had chronic stress or possibly even long-term depression that you have not addressed, your body thinks, right now, I need to keep you alive. You getting pregnant right now is not my priority. And so what commonly happens when you are stressed and you are not managing it well, it is harder for you to fall pregnant. Stress and excessive worry lead to overproduction of the stress hormones, such as cortisol and adrenaline. These hormones are our body's fight or flight hormones. They get your body ready for action, ready to run or to fight any danger. So when these hormones are elevated, they disturb the balance of our sex hormones, including the hormones that are needed for regular menses and ultimately ovulation. So when you've been stressed, you may not have regular periods and therefore you may not be ovulating regularly. In extreme cases of stress, ovulation may stop altogether. And obviously, if that happens, you have no chance of falling pregnant. If that's you, make sure you are addressing it immediately. There is cognitive behavioral therapy out there. You can have counseling, speak to your doctor. You might need some antidepressants or anti-anxiety medication, which you can always review the use of these drugs and whether or not they are appropriate once you fall pregnant. Tip 2. Sex. Yes, sex, that is the most important act. In fact, when it comes to talking about giving life to humanity, that is the act that God has created to be the start of a human life. So sex is important. And if you are trying to conceive, you must come together with your husband as frequently as possible. Without it, guess what? There'll be no babies. To maximize their chances of falling pregnant, couples must have intercourse during their fertile window and on the day of ovulation. Now, if you have enough energy to be sexually intimate every day during that fertile window, all well and good. In fact, I think it'd be great for your marriage. But look, if you don't have that energy, it's completely understandable. Having intercourse every other day is just fine. When it comes to sexual intercourse with the intention to fall pregnant, what you must remember is with healthy sperm cells that find themselves also in a female reproductive tract that is healthy, these sperm cells can survive for 5 days. Whereas on the other hand, once ovulation has happened and an egg is released, that egg can only survive for a maximum of 24 hours. So sex in those 3-4 days leading up to the release of that precious egg is just fine. In fact, very important. That's it for this episode of Fertility Tips and Tricks and Strategies. I will see you in our next video. Certainly looking forward to it. Take care.